So I think what I do is try to keep smile on my face every single day. And more importantly, if I'm really having a down day, I'm like, okay, so what was a good thing that happened today? And it might be something really small. It might be that the front door person for my condo said, "Hi, Dr. Koogler," as I walked in. I just try to remember that what happened that was good that day. Because yes, I might have many things that are bad, but I just try to remember something good that happened.
Hey everyone, this is Rod Cate and welcome to this week's episode of Rocket Motivation. First, I'd like to thank our sponsor, Gat Creek, a wood furniture manufacturer located in Berkeley Springs, West Virginia, designing and building one-of-a-kind furniture. Visit gatcreek.com. This week's guest is a physician practicing at the University of Chicago, one of the world's best medical centers, and specializing in treating pediatric patients. She had been practicing 18 years when she was diagnosed with stage 4 lung cancer. She overcame the lung cancer, but in 2019, 3 years after the lung cancer diagnosis, she was diagnosed with a glioblastoma, a very aggressive form of brain cancer. She's been fighting the glioblastoma ever since. In 2021, her doctors found another tumor in her brain that had metastasized years later from her lung cancer. She's fought through all of her medical conditions and refuses to quit on herself and her life that she loves.
2, 1.
Dr. Tracy Koogler, welcome to Rocket Motivation.
Thank you.
All right, great to have you. Just so the listeners know, so Tracy and I went to Davidson College together, so we've known each other for quite some time. But so Tracy, thanks for coming on Rocket Motivation to tell your story.
Thank you.
Okay. So first, Tracy, why don't you tell us where you are now in your life, kind of catch us up, what you're doing, how you spend your time.
So professionally, I am still working at the University of Chicago. I had to give up much of my clinical practice when I was diagnosed with lung cancer and additional things when I was diagnosed with my brain cancer. But I still work in pediatric sedation 2 days a week. So I take care of small children that need sedation for procedures that those of us as adults would not need. And then I also am the vice chair of the Institutional Review Board, which reviews all the research protocols that would be done at the University of Chicago. And I am also co-director of the Ethics Consultation Service. So I have a busy life at the University of Chicago, but it's a little bit different than what it was before I got sick. And then in the rest of my life, I am still a college basketball fanatic. I went to the Final Four for the University of Virginia, which is where I went to medical school immediately after I finished my initial therapy for my glioblastoma. And I then do travel recently, mostly around Lake Michigan to Michigan and Wisconsin and places like that.
Okay. All right. And so as you mentioned, I know after Davidson, you went to medical school at University of Virginia. And I know you did residencies and fellowships in pediatrics and pediatric critical care. And then you took the position at the University of Chicago in 1998 in the pediatric burn unit. Why the interest in taking care of children?
Essentially because children manage to come in and out of the hospital many times with a smile on their face. In the intensive care unit, yes, they don't always start out with a smile on their face, but they end up with a smile on their face. And for the most part, their pain needs are less than the adult world. And they just are as happy in the hospital as many times they are outside of the hospital. And that just makes them a special group of kids. And if you talk to them, they'll talk to you. They're just a special group of kids.
Right, I gotcha. All right, I know you practiced at the University of Chicago for 18 years before you were diagnosed with the lung cancer. So tell us about your career and life during that time.
So during that time, I did many of the same things that I'm doing now. There's really very little difference. I participated in the IRB. I participated in the Ethics Consultation Service, and I did the things that I'm doing now. I guess the other thing that I forgot to mention that I'm doing now is I have been going to Fourth Presbyterian Church, which is one of the largest Presbyterian churches probably in the United States. And definitely one of the largest churches, if not the largest, in the city of Chicago. And I've actually gotten more involved in their activities recently, which is a little ironic, but fundamentally getting sick sort of brought me back to my faith and back to how lucky I am and how I personally think God still has a plan for me, which is why I'm still here, because with my diagnoses, many people wouldn't still be here.
Right.
So I just feel lucky, and I feel like that God has helped me with that.
Right. Let me go back to, all right, in 2016, all right, the lung cancer diagnosis. I mean, I guess everything was going great. You loved your practice. You had a big clinical practice treating the kids that came in. 2016 hits, the lung cancer diagnosis. First of all, I mean, how did it come about that, that you started getting sick, that you needed to, seek medical treatment for that?
So, as a pediatric ICU doctor, we have lots of children that come in with viruses that make them really, really sick. And I was doing a week on service. So, I would work for 7 straight days in the ICU. I would have colleagues that would cover at night. And usually by the end of that week, I would have caught whatever virus or cold was going around the unit, despite the fact I was wearing appropriate, what we call PPE, to try to prevent that. And I would develop a chronic cough. And I sort of, in my own world, had a rule that if the chronic cough lasted 10 weeks, I'd go see a doctor. And the cough was getting pretty bad, but I was like, I'm just going to wait it out. I'm going to wait it out. And so I finally went to see my internist at 10 weeks, and he had seen me before, and he's like, this is probably nothing, but there's 10 other things you need to have done. And he then listened to me and he said, this is real. And he sent me for an x-ray, and then there was lots of fluid, and he sent me to the pulmonology department to have the fluid drawn off. And the fluid went to pathology, and the fluid came back as cancer. It was unclear what the primary was. So they did additional tests and recognized that it was lung cancer. And there is a type of lung cancer called EGFR positive lung cancer that is very common in women, and almost all the women have never smoked a day in their life. And we now have some great therapies for it. So that's what they diagnosed me with. And that's one of the reasons why I was stage 4 lung cancer. I'm here today.
And I think you mentioned earlier that you had to give up a lot of your clinical practice when you were diagnosed with the lung cancer. God, I mean, how tough was that?
It was tough. I had fundamentally decided, after I had gone through my medical school rotations, that I had wanted to be a pediatric intensive care unit doctor. This was a early decision fundamentally. And to have to give that up was a big problem. And as Rod stated at the beginning, when I first came to the University of Chicago, I also worked in the burn unit extensively. And then at some point, our burn unit was both adults and children. And I initially started working with both of them. It became apparent that I didn't think my adult skills were as good as I thought they should be. So I stepped away from the adults, but continued to take care of the children, and fundamentally did that successfully until I was diagnosed with glioblastoma. And when I was diagnosed with the lung cancer, I was told I couldn't work nights anymore, and I could not get my chronic cough. So I gave up working in the PICU. And then with the glioblastoma, for many reasons, it just didn't make sense for me to continue to be full-time in the in the burn unit. So I had to give up the burn unit. There was a lot more negotiating with the burn unit and the PICU and pediatrics as to how to set up that new program, but they have now successfully set that up. But fundamentally, I really gave up a lot of what I was doing in the burn unit just prior to COVID. And now they've actually figured out a way to make it all work.
And how did you deal with that mentally, where, you got your career going, you love what you're doing, you get the diagnosis of the lung cancer, and you got to give up a lot of your clinical practice. I mean, how are you dealing with that in your brain?
It was hard in my brain, but I had other things that I loved to do at the hospital. And I was close enough to medicine that I still ran into my colleagues and they still asked questions. And I ran into the nurses and they still asked me questions and they still said hello and how are you doing, et cetera. So it was definitely a hard transition, but I realized it was a necessary transition and I was still involved in morbidity and mortality rounds and we had education rounds for the fellows and I participated in those things.
And how important was that for you to kind of stay plugged in?
It was important. And I will tell you that last year at the fellow graduation, and the fellows is a 3-year fellowship, it was the first year that I really had not worked with any of the fellows that were graduating. And that felt really weird. And after that graduation, I cried because I was like, oh my gosh, I truly don't know these new graduates that we are sending out into the world as pediatric ICU physicians. And that was weird. But, I recognize that there are some things that I'm like, oh my gosh, I haven't done this in a while. I haven't seen this in a while. And I have found other things to fill it. I spend a lot more time with IRB protocols than I've ever spent. And I enjoy that, seeing what research is down the road and what's coming up next. And that's exciting and new. It's a different thing that I'm doing.
Well, so let's go to 2019 when you get diagnosed with the glioblastoma. All right, so tell us how that all came about.
I was sitting in an ethics meeting and I felt weird and I left the meeting and called my colleagues and said, somebody needs to come over here because it was a big academic campus and I didn't think I could get to the children's hospital. And I definitely didn't think I could get myself to the adult emergency department. So I phoned a friend and they came over and called the people that were necessary to call to get me safely to the emergency department. And they did scans in the emergency department and found a mass in my brain. And I was having intermittent seizures. And so they were treating me for intermittent seizures and took me up to the neuro ICU. And that's fundamentally how I was diagnosed. It was on January 16th, 2019. They called my mother and she flew in from Virginia. And I was on the operating table on January 20th.
Well, first of all, what is a glioblastoma for us non-medical people?
A glioblastoma is really sort of a stage 4 glioma, which is just many of the brain tumors are forms of glioma. And there's a stage 1, a stage 2, a stage 3, and a stage 4. A glioblastoma is bad. If you read the literature, 50% are alive at a year. And I've got special therapy on my brain, you've got less than 5% are alive at 5 years. If you wear my Optune, it's up to 12%. So glioblastomas overall has a very poor prognosis. And I knew this.
Right. But you have surgery. What did they do during the surgery?
During the surgery, the neurosurgeon who I knew well came out and told me that he had gotten it all, that it scooped out super easy. It was actually a very short surgery, which surprised me. And when I talked to the neurosurgeon, said it also surprised him, but he thought he got all of it. And apparently he did.
Well, so where are you now with your glioblastoma? Do you still have it in your brain? What's going on with that?
Well, there's scar tissue where the surgery was done. And I initially had radiation and chemotherapy. And after I was done with radiation, they started something called Optune, which is essentially magnets that create an electromagnetic field that kill the fast growing cells, apoptosis for any scientific people. And it is FDA approved. It's FDA approved for 6 months, but people can use it for longer than that. I've been using it for 2 years. And I attribute a lot of my health to that. So I am on that now, and I get scans every 6 to 12 weeks, depending on what's going on otherwise. And so that's what's going on.
Well, and then on top of that, just for the I guess for the cherry on the top, in 2021, they find a new brain tumor
Yes.
that is actually metastasized from your prior lung cancer.
Yes.
So tell us about that.
So that it's interesting because I would argue that there was a shadow in that location for probably a year that everybody sort of went, eh. And then it really sort of stopped being a shadow and looked more like a mass. And I get my glioblastoma care fundamentally at both my home institution as well as another major institution in the city. And everybody thought that it was probably another glioblastoma, but no one was sure. And there was debate as to whether or not I should have surgery to potentially have it removed or potentially just have it biopsied. And my neurosurgeon was very careful in what he was going to do, but he decided we really needed to do surgery. I agreed with him, and we did surgery. And yes, it came back as a lung metastasis, not as a glioblastoma. I will tell you, no one at either institution thought that was going to be the case. And my medical teams figured out what was the best next step. And so that's what we did. And I'm on increased lung cancer meds, and everything else at the moment is the same. And I will get my next set of brain scans in just a couple of weeks.
Right. So Tracy, I mean, you're in the throes. I mean, as we sit here today, we're talking. I mean, you're in the throes of fighting this as we speak.
Yes, I am.
Okay. And I mean, as we sit here today, what do you know what your prognosis is?
If you read the textbooks and if you read the papers, it's still not good at 5 years. But, I know one person who was still alive at 11 years. And I unfortunately know many people that died within 2 years, and I've exceeded 2 years. So I don't know exactly. I guess I've always been a patient that prepared for the worst, but hoped for the best and lived each day as if it could be my last, recognizing that brain tumors can do all sorts of weird things to you. And since I have a seizure disorder, I can't drive. My mother has spent most of the COVID pandemic with me in Chicago. So I've taught her how to drive in Chicago versus rural Virginia.
And how's that been going?
She's gotten very good at it.
That's good. Well, Tracy, let me ask you this. I mean, so, you for 18 years, you've had a spectacular career as a physician treating pediatric patients. You've had all these, these conditions that have just, were thrust upon you. And nothing that you did really to deserve it. I mean, you're not a smoker. You got the lung cancer, you got the glioblastoma. So you're in the process of fighting it. So how have you been able to handle all of this adversity?
Well, I personally don't think I could do anything else. I've had lots of friends and colleagues go, why haven't you just gotten a place at the beach and sit at the beach and maybe write? And I'm not a writer. I know I'm in academic medicine, but I'm not a writer. I love to teach. I love to talk. I can make slides, but I just didn't envision myself sitting on a beach and writing or sitting on a beach and reading. And because I really love what I do every day, I love the interaction. The kids that I take care of in pediatric sedation are just hilarious. I interact with a lot of 3 to 6 year olds, and they've always been my favorite age because they tell you the truth. They're just super good kids. And I had one little boy who saw these things on my head and said, "What kind of cancer do you have?" He said, "Do you have neuroblastoma?" Which is what he had. And I said, "No." And he said, "Are you sure?" And I mean, I could just see him like jumping off the bed and going over to the cancer center and saying, "I want what Dr. Koogler has because that's cooler than what I have."
Yeah.
For treatment. They make me laugh. They're really good kids, and I really like taking care of them. But I also like everything else I do. I really enjoy it. I really work hard.
I guess that's part of it is that instead of sitting on a beach somewhere reading a book and basically doing nothing versus it sounds like to me, I mean, you're still incredibly busy with your job. Do you think that's beneficial I mean, for you mentally and emotionally to stay busy, to stay engaged in life?
For me, it is exceedingly beneficial. I can't imagine stopping what I'm doing. I can't. And my mother has spent time with me post initial diagnosis for the lung cancer and post, post both surgeries, but more importantly, post the first surgery. And post the first surgery, she walked into my neurosurgeon's office and said, "Okay, she's been at home for 3 weeks. She's either has to be admitted to a psych hospital or you have to let her go back to work." I have to be working. I feel like a lot of what I do working and also with the things I'm doing at church are helping other people. And I think that's really important. And I think that's been my goal. Yes, I've always been that busy person, and I just can't imagine not being that busy person.
Right. I mean, through all of this, I mean, have you ever had the why me moment?
Yes, I can't tell you exactly when it was. I'm sure it started out when I had the initial test done, when I had the chronic cough. I knew it was lung cancer. The biggest why me was, how in the world am I going to tell my mother that I have lung cancer? I hadn't lived around secondhand smoke. I hadn't smoked, but I didn't grow up around smokers. And so it was just really weird to think that I had lung cancer and I didn't have any of the traits of a classic lung cancer. So it was just, yes. And I was like, I've got to tell mom that I have cancer.
I think the first time I met you, I know it was through the football team because you were a trainer, and my brother played, and I think all my friends were on the football team, and so you saw me walking around, and I, with my cane and everything, and one thing that I've through my life, when you have something going on like what I had, and maybe what you have, you get somewhat philosophical on life. It's almost like you can, or like this, I can kind of step back from it sometimes, and since I'm not normal. And then you kind of look back at how the normal people are acting. At this point, do you get somewhat philosophical, or I mean, what's your philosophy on life right now?
My philosophy on life is that I'm an exceedingly lucky person. You can say that, God has given me grace. The biggest thing is that if I did not work in the location that I work at, I would not have had the possibility of really getting amazing medical care at 2 amazing institutions, 2 academic institutions. And I do have amazing insurance, and my copays are real. I tell many people that my copays are fundamentally a nice night out at dinner in Chicago, but others that work at the University of Chicago as social workers, as environmental services people, as administrative assistants, couldn't pay those copays, even though they might have my insurance. And so I am seeing firsthand and understanding firsthand the disparities, and they're real and they're scary. And if I didn't have a great insurance, I don't know how I would do any of this. The drug expenses are really high. And I've got amazing insurance that pays almost all of it. And I'm left with a nice dinner in Chicago. which is not an unusual thing for me. And so that's really important for me to understand. And I do toss it around in my head all the time. How do I write that paper? And I want to write it from a personal standpoint. I really have no interest in spending the additional time and energy to look up all the data. I know there's data out there. The University of Chicago has the data, but it's real. For me, it's scary.
And you say scary for those that either don't have insurance or don't have the means to make the copays, that I guess they're not going to get the same care that you get.
I definitively don't think they're going to get the same care that I get. For one thing, they're not going to be able to afford it. My outpatient medications and my Optune, the insurance company is paying probably $50,000 a month for those things. My copay is $250 to $400 a month. And as I said, that's not much for me. That's a lot of money for someone on a limited income. And if they're a Medicaid patient or unfortunately an uninsured patient, they're not going to get access to probably any of this. It's going to depend on the state for Medicaid, but it really is going to limit the possibilities of any of this. And they're going to get what fundamentally is considered second level care in 2021 in the United States.
And so to put a bow around this, I mean, here you are going through everything you're going through and basically fighting for your life. But what's concerning you most is about other people who might be going through the same thing, that they're not going to get the care that you're going to get.
Yes.
Okay. Well, you need to write that paper.
I know.
It's like being back at Davidson in English. You got to get that paper done by Wednesday. Well, Tracy, let me ask you this, and this is just in broad general terms, and not so much the specifics of someone going through a specific medical problem, but based on what you've gone through, and you're fighting today. What advice would you give just someone that's going through some tough times in their life? What do you tell them on, based on what you've been through, something that they can latch on to maybe help themselves?
So I think what I do is try to keep smile on my face every single day. And more importantly, I try to, if I'm really having a down day, I'm like, okay, so what was a good thing that happened today? And it might be something really small. It might be that I ran into my neighbor in the hallway. It might be that the front door person for my condo said, "Hi, Dr. Koogler," as I walked in. I just try to remember that what happened that was good that day. Because yes, I might have many things that are bad, but I just try to remember something good that happened. And there's always something good.
Tracy, through all of this, did you ever just think about giving up?
No, I really didn't. I guess I'm just not that person. I push through. I get tired, and I tell everybody, I said, before I got sick, I probably worked a lot of 16 and 18-hour days. And my doctor sat me down and said, this is not going to happen anymore. The rest of us work 10-hour days. And I'm like, but that's not me. I'm working 10 to 12-hour days now. And to me, it makes my life harder, but I'm not going to stop. I'm just not.
Well, Tracy, I always give all my guests the parting shot. So if there's something that we haven't discussed, what haven't I asked you that's important?
Well, I guess the last thing that I have, and I have spoken to many people with cancer, is when people ask me, what is your advice about a diagnosis that I've just gotten or a diagnosis that I haven't gotten, but I've got these symptoms? And I always say, and I've always gotten the response once they've sought it out, that they need to go to an academic institution, even if it's for a second opinion. You don't need to go to Boston. You don't need to go to Texas, which have got huge cancer programs, but you need to go somewhere. And fundamentally, I feel like if you get to an academic medical center, in your town, in your state, they really can be helpful. And I think that's really important. You fight for yourself as much as you can if you are faced with a diagnosis that you may love the doctor that's taking care of you, but we all deserve a second opinion, and it's really worthwhile to try to get it. And if you have an insurance situation or something that it's impossible, talk to your insurance company, talk to the second opinion, and see what can be worked out, because I really think that's important.
All right. Well, Tracy, I want to thank you so much for coming on and telling your story. I've known you for a long time, and, I hate that this is going on in your life, but you're handling it well. I mean, somebody from the outside looking in, just seeing you that you haven't quit. When you say you're just working 10 to 12-hour days, I mean, it's like that's probably 75% more than most people work on an average day. So,
but you're a lawyer, so you work that many.
Well, maybe on my timesheet. No, just kidding. But really, I mean, thanks so much for coming on, Tracy. But just
okay,
just keep fighting it.
I will.
Dr. Tracy Koogler's story is so inspiring. She refuses to give up. She keeps battling her brain cancer so she can continue living her great life of being a pediatric physician. Next week's guest is Eric Foster. He's a lawyer practicing in Cleveland, Ohio. He will tell his story of dealing with and overcoming self-doubt. It's going to be a great episode. See you next week. Rocket Motivation partners with Gat Creek, one of America's premier wood furniture makers. Clean, timeless designs define the Gat Creek look. Their made-to-order furniture effortlessly connects with a range of styles from modern to traditional. Check out their full range of products at gatcreek.com. If you're interested in getting my book, Get Back Up, just go to Amazon and put in Get Back Up and my name, Rod Caden. It'll pop right up. I would love it if you would subscribe to the podcast and rate and review the show wherever you listen to your podcasts. I would really appreciate it if you'd share it with a friend. I would like as many people to hear my message as possible. Never give up and always get back up. And we'll see you next week.